Our next speaker is LaRay Brown, who is Senior Vice President of the New York City Health and Hospitals Corporation. I'm sure you've all heard of HHC. It's the largest hospital system in the United States. She's going to talk about how the new law will impact HHC, will impact the immigrant populations, and also talk about the issues of Medicaid and the new law. LaRay Brown. Thank you.
Thank you very much. I want to make one correction. We're not the largest hospital system in the United States. We are the largest municipal hospital system in the United States. We are, I don't want our folks from the VA system to say that we're taking up their space. But that being said, that's a real big thing. And in fact, HHC serves 1.3 million individuals every year. And the other real big thing, which is why I believe I'm here, and which is why we at HHC have celebrated the enactment of health reform, is because every year we serve a significant number of truly uninsured people, not just folks who are insured and whose insurance won't pay fully for their care, but we're talking about folks who have no insurance and have very little resources. And in fact, 75% of those 1.3 million individuals that HHC serves are medically indigent in some way, are poor. And that includes Medicaid, whereas they're insured, but they're low income, and uninsured. Last year, 2009, HHC served more than 432,000 uninsured patients. 432,000 people. That was a 13% increase from 2006, and there are a lot of reasons for that. But we hope that at least 130,000 of those individuals will be able to have insurance with the health reform. Probably most of those individuals will be insured through the expansions of the Medicaid program, because as I said, many of our patients who are uninsured are poor or low income. However, the disappointment, notwithstanding our celebration in terms of health reform, the disappointment, if we do the math, 130,000 of those individuals will be picked up through a Medicaid expansion program. The remaining, the more than 300,000 folks, won't be picked up at all. And why? Because those individuals are immigrants. Those individuals are undocumented immigrants, and unfortunately, the law only covers Americans. Now in New York, the city of immigrants, that's not something to celebrate, and we'd hope that that would be changed. That's a disappointment. But that being said, we still are jubilant about health reform, because we believe, and have believed since the inception of HHC, that everybody should have access to quality health care, access to accessible health care, and access to respectful and culturally relevant health care. So this is still a good thing, notwithstanding the challenges in terms of undocumented immigrants. There are some other good things, and there are some other challenges. Just to add to the challenge, one of the ways that the federal government will pay for the health coverage of the 32 million Americans is by reducing some payments to hospitals and reducing some allotments to states. And in particular, funding that has historically gone to states for the payment of hospitals who provide a disproportionate share of care for uninsured individuals and a disproportionate share of care for Medicaid individuals, or DSH funding. That funding will be reduced over time. Now, the great thing is that as a result of a lot of improvements between what was in the Senate bill and what actually got enacted, was that those payments will not be as reduced as much as what had originally been conceived, and so that's a really great thing. But let me also talk about some opportunities, because in those 2,000 pages, there is what's called the Centers for Medicaid and Medicare Services Innovation Center. There's I think $10 billion, and my voice gets picked up because that's a lot of money. There's $10 million that this Center for Innovations will have to work with states and work with providers to do things that are different, to encourage health services delivery reform, because we've been talking about insurance delivery reform, insurance coverage reform, I should say, but there's a huge need for the change in how we care for individuals, and in particular, an opportunity to provide something in a way that actually does align the financial or payment with the services delivery. Those incentives have been whack, as my son would say. We've been whack in terms of how and what we get paid for as healthcare providers. On the one hand, folks want to provide preventive care and wellness care and all the screenings, but you don't get paid to do that. In fact, if you're really good at that, you keep people out of the hospital. And if you're a hospital system, you rely on having people in the hospital to pay for your operations. That is whack. Hopefully, with the Innovation Center, they will have pilots for demonstrations for global capitation. Why does HHC celebrate that? Because we have a health plan, Metro Plus, that's rated #1 in this state for quality and cost, and that has used its premium to incentivize, to pay for preventive and wellness services. And while we have kept 75% of the youngsters who have asthma out of the hospital, and while we are keeping diabetics, their hemoglobin A1Cs controlled and reducing their emergency room use and hospitalization, the only way we get any remuneration from that is through our own health plan, which has 400,000 members, most of whom get their care by HHC. We are looking forward to participating in one of those demos under that Center for Medicaid and Medicare Innovation Center to look at our whole system, because we think we're geared and we're poised to do that. So that's really great, because we are hoping that, frankly, while there will be more people covered, there will be a change in how healthcare services is delivered in this country, and in particularly in a hospital-centric or focused system like New York City. So I'm being told I have 1 minute. Let me just say this. We are very excited that many of our patients who are uninsured today, the 130,000, will have insurance. But I have to tell you, we are also, this is the challenge, we are also unfortunately anticipating that those entities, hospitals in particular, not our friends with the FQHCs, who are currently serving a small, albeit, a number of uninsured people today, that many of those, if those folks are uninsured and undocumented, that HAC will be seeing even more uninsured patients. We don't want that to happen, but we know that's an inevitability. So that's why we are looking forward to being part of demonstrations with the federal government and with our colleagues at the state as to how can we reform the payment delivery system, how can we take things out of whack to support the very essence of healthcare reform from a perspective of keeping people healthy, improving the health of populations and communities. And I'm looking very much forward to that. Thank you very much.